Relief Solutions. I'm a lifestyle coach and a cognitive behavioral therapist. There is not a single sport that I have not watched or played, but if you ask for a favorite, then it's cricket and basketball. My favorite player is Michael Jordan, the one and only. In my practice as a pain specialist, almost 75% of the patients who come with chronic pain do have mental health issues, the most common being anxiety and depression. There is also a small subset of patients who actually have depression, and these patients have a psychological pain. As a pain management specialist, I look at three things in a patient. I follow the Biopsychosocial model. It's not just the pain that I look at, but also the psychological influences on the patient and the social structure that the patient is coming from. These basically influence the experience of pain in the patient. So for me, understanding a patient's psyche is as important as the diagnosis for his pain. Many patients with pain are quite explicit about how depressed and anxious they are about the pain that they have been going through. But my job is basically to identify the patients who underplay the pain and also underplay the amount of mental stress they are in. Most of these patients are the ones who basically have suicidal tendencies, they're depressed chronically. And these are the patients who are unlikely to have support from their carers, their friends, and also their immediate family. Being a cognitive behavioral therapist myself, I counsel my patients wherever I think they need psychological support, especially if they are mentally disturbed. But in cases where I think it's beyond the limits of my knowledge and skills, I send them to a psychologist. And in some cases where actually anxiety and depression is a form of disease, then I send the patients to a psychiatrist. Since I started my independent practice as a pain practitioner, I have been away from sports for a good 2 years. And basically that I thought was to establish my practice. On the contrary, it has not helped me much. It took me a while before I realized that sports is integral to my practice as well. I'll tell you why in the next minute. But since I've been alone, all I've been doing was seeing patients, going home. So there was a bit of, lack of quality in my life. But then when I decided consciously that I should get back to active sports, which I used to enjoy and I used to participate in, thanks to my friends, well-wishers and the family, I have been feeling much better. I've started playing my cricket again. I've started trekking, which is one of my passions. And what it basically has done is it has helped me become physically more fit, mentally more alert, more empathetic, and also interact with my patients much better. I eat less, but it's going to be nutritious food. I exercise moderately at least 5 to 6 times a week, at least half an hour to 45 minutes a day, which includes a bit of resistance training, flexibility training, and aerobics. I sleep very well, at least 8 hours, and if I get time in the afternoon when there are no patients, I have my own siesta, about 15 to 20 minutes. Power nap is good, but more importantly, I connect with my friends, my family, and I also connect with my patients. Here is the catch. We are social animals. We feel better when we are in company. And if you have a problem, share the problem. It's going to reduce the burden on you. And more importantly, there is nothing or nobody who is basically immune to stress Anybody can be stressed, although they may not know that they're actually in stress. Talking out will basically help. So talk, that's going to help you and get you out of trouble. Any sport, in my case it's cricket, will contribute to better mental well-being. There are many reasons to it, but for me the most important reason is because it is a sport, it involves a bit of physical activity. So physical activity always contributes to better mental well-being, and also the fact that you're interacting with your team members and the opposition players, and in the end of the match, whether you win or lose, you basically again have a social gathering and brainstorm about the match, whether you win or lose, and have a bit of a laugh at the end of the match. This gives you a feel-good factor, and that basically contributes to less stress and less of stress on your mind. Do you know that India has the highest number of patients with mental health disorders compared to the rest of the world? Do you know that the incidence of suicide, especially teenage suicide, is on the rise in India? And do you know that 50% of corporate employees are depressed? There is a lot of stigma attached to mental health awareness in our country. Basically, a lot of people do not know what mental illness is. Most of the times they think that it is a symptom of a disease. No, it is not. Most of the times they think that they cannot be mentally sick. It is only the other person who is sick. They think that they are immune to mental illness. They are immune to stress. Most of the times they think that people with mental illness are violent. Only about 1% of them are. Most of the times they are very well mannered. They usually don't talk a lot. They usually are too within themselves. So these are the signs that have to be seen. But the most important thing is we have to talk about mental health as a subject. We have to spread the awareness about mental health to the people. It is a new pandemic which is spreading across the world. If we have a physical problem, we go to a doctor. We try to basically get ourselves tested, investigated, and get ourselves treated for it. But when it comes to mental health, nobody knows where to go. Nobody knows whom to talk. And a simple thing like talking to a friend, a relative, your parents, or your sibling basically will highlight the issue that you're going through, and it is easy for you to seek help, or for that matter, any individual who is going through mental stress. In my opinion, 3 important tips that I can give to people is basically exercise regularly, sleep well, and talk your problems. That's basically the 3 things that you need to do.